10 complications following extraction of wisdom teeth. Underline. Complications after or during wisdom teeth extractions are fairly common, full stop. Some complications are fairly minor, however others can be more serious, with some being permanent and even life-threatening, full stop. So here is a list of the 10 most common complications following or during wisdom tooth extractions, full stop. Number 1, bleeding. Underline. Bleeding after having a tooth extraction is common and most commonly occurs when you've got back home following the extractions at the dental surgery or the hospital, full stop. Immediately after you have had the wisdom tooth or wisdom teeth removed, the dentist or the surgeon will always check to make sure that all bleeding has stopped before you are allowed to go home, full stop. However, after 2 or 3 hours, or commonly when you're lying flat in bed at night time, the extraction socket can start bleeding profusely, full stop. Sometimes the bleeding is very minor, but because it mixes in with saliva, it appears that a huge amount of bleeding is occurring, full stop. 9 times out of 10, the bleeding is easily stopped by biting on a damp tissue or towel for 10 minutes, full stop. This is usually enough to stop the bleeding, but if the bleeding continues, you can apply the tissue or towel for another 10 minutes, full stop. If after this time, the socket is still bleeding, then you should seek emergency advice, full stop. The emergency advice can be by ringing the practice, and all practices should give out a 24-hour emergency number, full stop. Number 2, infections. Underline. Infections following wisdom tooth extractions can be very painful and can go on for a few weeks, full stop. The most common and likely cause of infection is called a dry socket, full stop. A dry socket occurs more commonly in smokers, or if the extraction was particularly difficult. Full stop. You will know when you have a dry socket because it will be extremely painful. Full stop. The pain is often worse than the original pain for which you had the wisdom teeth out for. Full stop. This pain from a dry socket is constant, and painkillers do not seem to help. Full stop. The only solution is to go back to your dentist, who will then pack an antimicrobial paste or gel or dressing into the socket after washing it out thoroughly with saline. Full stop. A dry socket doesn't usually need antibiotics, and the condition starts to ease off after a few days. Full stop. It may be necessary to have the dressing and socket looked at again and treated again if necessary. Full stop. Number 3. Sutures dislodging. Underline. If the wisdom tooth extraction is not straightforward, it is necessary sometimes to place stitches or sutures to close the socket up properly. Full stop. The sutures can become dislodged when you go home, and if this happens, then you should ring your dentist up for further advice. Full stop. Most of the time, it is not usually necessary to have new sutures placed unless the gap is very big or there is a danger of the socket being open and becoming infected. Full stop. Number 4. Underline. Bone fragments. You may notice that after you have had your wisdom tooth out, that little bits of bone work their way out into your mouth, and sometimes you can even feel loose bits of bone with your tongue. Full stop. This is usually not a problem unless the bone is causing discomfort to your tongue, or if the socket is painful, which could point out to an infected socket. Full stop. Number 5. Nerve damage. Underline. Nerve damage is not always avoidable during wisdom tooth extractions. Full stop. Nerve damage can be temporary or permanent and has been discussed in a different section of this same article, full stop. Number 6, underline. Oroantral fistula, spelling ORO-ANTRAL FISTULA, oroantral fistula, or capital O, capital A, capital F for short. An oroantral fistula can occur when an upper wisdom tooth is taken out, full stop. An oroantral fistula happens because when the wisdom tooth is taken out, you are left with a direct communication between the oral cavity and the sinus in the upper jawbone, full stop. The dentist usually knows that an OAF has occurred when he has taken the tooth out, but an AOF can also occur without the dentist being aware and without any problems occurring, full stop. As a patient, you will know that an OAF has occurred because you will notice that when you blow your nose, that air is forced into your mouth due to the direct communication, full stop. Also, the socket will take a long time to heal up, Another sign of a OAF is when you put water in your mouth, and the water runs up into your nose, full stop. An OAF can heal up by itself, but usually you will need further specialist advice and treatment at the oral surgery department of your local hospital, full stop. In the first instance, you will need to see your dentist, who will assess the oroantral fistula and decide if you need to be referred to the hospital, full stop. Number 7, underline. Fractures. Fractures can occur either around or in the jawbone where the wisdom tooth was, or fracture of the wisdom tooth itself, full stop. Fracture of the jawbone can occur if the wisdom tooth puts up a lot of resistance and the force of the extraction causes a jawbone fracture, full stop. A jawbone fracture will be very painful, and there will also be bleeding along the fracture line, full stop. In the upper jaw, a whole section of the jawbone called the maxillary tuberosity Maxillary, tuberosity, tuberosity, can become detached from the rest of the jawbone, full stop. Each fracture or a fracture of the maxillary tuberosity has to be assessed on its own merits and treated accordingly, full stop. Fractures, new paragraph. Fractures of the wisdom tooth itself are very common, especially if the extraction is going to be a difficult one, full stop. When a fracture occurs, it can be alarming for you as a patient, but for a skilled dentist, it can still be removed, full stop. When a root fracture or crown fracture happens, it is usually necessary to carry out a surgical extraction, full stop. A surgical extraction involves lifting the gum away around the tooth and drilling away some of the jawbone around the retained fragment of tooth, in order to take it out fully, full stop. Number 8, trismus, Trismus, underline. Trismus means that you cannot fully open your mouth, full stop. Trismus can cause pain in and around the jaw joint, but also around the muscles, full stop. Trismus can happen if, when the injection is given, the needle pierces and damages the muscles around the jaw joint, full stop. Another way for trismus to happen is trauma to the jaw joint during opening wide when you are having the wisdom tooth taken out, full stop. Trismus usually only lasts a few days, and your dentist can give you special exercises to do in order to get your mouth opening fully and pain-free again, full stop. Number 9, medical emergencies, underline. The most common medical complication is simple fainting, full stop. Fainting will usually happen either before or when the injection is given, full stop. Fainting can happen to anyone, and when you faint, the dentist will simply lie you back to allow a good blood flow back to your brain, full stop. You may also need to have a glucose drink to give your blood sugar levels a boost, full stop. There are other medical emergencies that can happen but are fairly uncommon, such as an epileptic fit, a heart attack, a diabetic coma, and shock, full stop. All dentists are proficient in providing medical emergencies care, and all practices have a medical emergencies kit with all the equipment and drugs necessary to treat a medical emergency, full stop. Number 10. Underline damage to the adjacent tooth. Damage to the adjacent tooth can occur if the wisdom tooth is impacted, and whilst the dentist is trying to take out the tooth, damage occurs to the adjacent tooth, full stop. Damage to the adjacent tooth is usually minor, such as a small chip, and it can be filled or treated later on when everything has healed up, full stop. Occasionally, the damage can be more severe, such as loosening the adjacent tooth, and eventually this tooth could be lost, full stop. That's it.